So my name is Hasan Ali. I'm a plastic surgeon. I have offices in Dubai and London. I'm working here in London, and also I work from time to time in Dubai as well. That's an interesting question. Basically, my parents, that they motivated me to become a doctor. My father was running a hospital back home, and and we seen it in our house that the medical and healthcare was his desire that I should follow, and so that was probably honestly the reason of me becoming a doctor, and obviously again plastic surgery also was his wish that I wanted to follow, and I'm glad I listened to him. Okay, I think I partly answered that, but I started with obviously a reconstruction training, and I attended some burns patients in the beginning, and what I do normally now, body contouring, and very initially in my career, I seen body contouring procedures which were very unique at that time because people were not opting for liposuction and body lift procedure at that time, but I seen them in the beginning and I really liked it. So that was a reason that I chose subspecialty of plastic surgery with the body contouring. Rewarding thing is patient satisfaction, and when the patients are happy, I think that probably would be the best thing. You can say that it's rewarding when you see patients are happy and they are satisfied with your service or your treatment, and that makes you really happy. Obviously, if the patient is not happy, that affects the surgeon as well. Most of the good surgeons, I think that's the most rewarding thing is the patient happiness. I think I don't like to say good things about myself. I would leave this to the patient to decide if I'm a good surgeon or if I'm a good doctor. Most of my patients, they say that I'm honest. I'm not looking at the monetarily part. So I try to help patients when they need it. And I like the same thing when you advise the patient. They listen to your professional advice, which may not necessarily sometimes the ideal advice, but we always think of a patient and we always want the patient best. So I think the best relationship between a doctor and a patient is when they both are on the same page and they both understand each other very well. And I think that is the time when the doctor should decide to go ahead and do the procedure, when understanding is good between the patient and doctor. Not really, but I think I would say the honesty is the only policy in any business or in any work. And for a doctor, honesty is extremely important. There shouldn't be any monetarily factors in opting the treatment for the patient. It should be always something that you opt is the best for the patient, may not liked by the patient, but still, I think that's probably, it's not a short phrase that I would recommend. I will say that, you should have a fair and honest relation with the patient.